Hello, welcome to the Chronometriq webinar. Today's subject will be Save Time by Improving Your Clinic's Productivity. It will be presented by myself, Hulong Nguyen. I'm a healthcare solution specialist at Chronometriq. Um, Chronometriq, we're a Canadian company, and since 2012, we develop and we offer productivity tools for medical clinics such as yourselves. We have over 300 clinics working with us throughout Canada with various EMRs, TELUS being one of our main partners in Canada. The five subjects we'll about today is the problems in clinics we work with, chronometric solutions that we have developed, design considerations, real implementation examples, and questions that you might have. Problems in clinic, what do they want? We've surveyed and asked questions to the clinics we work with, to their patients, to clinic staff, to clinic managers, and we've collected various problems that they found at clinics that they wanted us to work on. So first of all, clinics, what they've told us is that they would like to be able to book their medical appointments online. They'd like to be more autonomous when it comes to their health and be able to communicate more easily with the clinic and its staff. When you're thinking about online booking, they already do it with so many of their different services, whether it's making restaurant reservations or booking an appointment at their hairdresser. They're used to being able to book their appointments online. Patients would like to be empowered when everything regarding their health, and of course, being able to communicate more easily with the staff, the clinic, and its staff. We might be thinking about being able to call the clinic instead of waiting a few hours or sorry, a few minutes on your phone queues. Then they'd like to be able to communicate easier with the clinic and their staff. We've also talked to clinic staff, and they've mentioned to us that they'd like to have a healthier, less stressful work environment. We know that working in the medical field is not always easy, so we'd like to be able to help the staff with that. They'd like also to have more time and do fewer redundant tasks and more rewarding tasks. As we all know, the role of medical office assistant did evolve with time, the EMR being something that they had to learn to work with and other tasks. When we look at online booking appointments by phone, calling back patients, or even checking in patients, often those are the three tasks that receptionists and clinic medical office assistant tell us that they like to be able to automate these processes so that they have more time to spend with the patients that actually need that extra time. We've also talked to clinic managers, and what they've told us is that they want to be able to do more with the same means to increase productivity. As we all know, patients always need to see doctors and go to the clinic, and and clinic managers and owners want to be able to do more with the same team that they have in place. They like to reduce staff turnover. That's one of the comments that we had a lot. Um, they mentioned that staff often change clinics or we're not staying long enough in their team at the clinic. So by providing a healthier and less stressful work environment, we think we can reduce staff turnover. Clinic managers also told us that they want to keep the clinic attractive not only for patients, but also for potential employees, for potential doctors, so to keep the clinic competitive compared to the competition. And finally, they told us that they want to ensure the clinic's budget is well managed. And that is something that is extremely important for us and that we aim to achieve and to help clinic managers with. So now that we had a look at what patients, clinic staff, and clinic managers told us they wanted us to help them fix, the problems they wanted us to help them fix, let's have a look at the solutions that we developed, taking into account what they told us. So, first of all, our goal is to increase clinic productivity while empowering patients. So, we are touching all three of the people at the clinic, all the three groups of people at the clinic. And we've developed a complete suite of solutions. So, there's Chrono Booking, Chrono Remind, and Chrono Kiosk. Before having a look in more details of the three solutions, let's talk a bit about our integration with PS Suite and MedAccess. So we are fully integrated with PS Suite and MidAccess. What that means is that we are able to read information in PS Suite. For example, is that patient a patient, one of your patient right now? Is he rostered to the clinic, or what are your availabilities at the moment? But we're also able to write information. So as soon as an appointment is booked, it will appear in your um, schedule. As soon as an appointment is confirmed or checked in, it will appear in your schedule in PS Suite. So everything is done in PS Suite, but we are fully integrated. So let's have a look at online appointment booking. So usually patients, while they book an appointment, will start by going to your website. And from your website, they can click on a button, book an appointment, and that will bring them to the booking portal, the Chronometriq booking portal. For clinics who do not have a website, we also have an online registry where you can direct your patients to that online website so that they can find the clinic. So this is an example of a booking portal that we created for the demos. So right here, patients are able to book their appointment with their health card number. If it's a recurring patient, then of course you can decide if who's allowed to book online. If you want new patients that that do not have a file in MedAccess or PS Suite to book an appointment online with you, it's possible to do so. It's also possible to allow patients without a health card to book an appointment. So I'm just gonna consent, click on I'm not a robot and start booking with my demo patient, John Smith. So John here can update his email address and it will be updated into the EMR. I can confirm, and now I can select an appointment type. In this case, I'm choosing the appointment type minor emergency, and there's a description here that patients can read and that you can customize. I'll describe my symptoms, which will go into the EMR schedule, into the note of the appointment in the schedule. I'm going to check for availabilities. In this case, I see that my provider, Caroline Evans, has availabilities here. So I could choose an availability for Monday, September 23rd at 6:30 p.m. and I can book that availability. We do support advanced access, so if you want to allow your patients to book within a certain time frame, it is possible to restrict that time frame. I'm going to book, and then I can confirm. John Smith can confirm all of his information. Confirm appointment. There's a pop-up where clinics will often put their cancellation policy. I can continue, and there you go. The appointment is booked. I can go and have a look into my email inbox, and I'll see that I've received and the address, the date, the time, the name of the professional. I can add that to my calendar, and I can cancel my appointment from said email confirmation. Let's now have a look at the automated appointment reminders. For the automated appointment reminders, it's possible to send them by three ways: by SMS, by email, and by voice call. And it is also possible to customize the content of the messages. This is an example of an email reminder. So, of course, the content is customizable and there are fields that are automatically uh, f- uh, filled, such as the name, the date, the time, the name of the doctor. The patient can confirm or cancel. Once the patient confirms, the status of the appointment will be updated in MedAccess and PS Suite so that you know which patient confirmed or not. This is an example of an SMS reminder. So as I mentioned earlier, the content of the message is fully customizable. In this case, the clinic decided to add links to the cancellation policy, to the booking portal, or even to the website of the clinic. Last but not least, we have voice reminders. So we can send callback patients and send them a reminder for their appointment. We can also use the clinic's phone number to do our phone calls. Let's have a look at our dashboard. Our dashboard is where clinics will configure and monitor the uses of our system. If I have a look at appointment reminders, I can see that there are different settings that I can set up. So I can determine the number of reminders I want to send. So one, two, three. Three might seem like a lot, but as soon as a patient will confirm their appointment, they won't receive any subsequent reminders. The clinic can also decide how many days in advance they want to send those reminders out. So 543 is a very popular configuration. And then clinics can also decide how they want to send those. Do they want to do a combination of email and SMS, and then email or voice call? So it's really up to you to decide how things are set up, and you can always change the settings at all times. The content of the messages are also customizable. So if you want to send custom messages by appointment type, it is absolutely possible. We have a lot of specialists who have instructions to give out to their patients before their appointment. So we are able to do that according to the appointment type that patients have booked. For the medical check-in kiosk, um, the kiosk is inspired by our experience in our day-to-day life. And when we go to the bank to withdraw money, we go to the ATM. At airports, we have to check in at kiosk. Even at customs now, we have to go through a kiosk. So it expedites the process and empowers patients to fill out that information by themselves. This is an example of three of our models that we have for a kiosk. So we have one that goes into a wall, one that goes on a desk, and one that's a floor mounted on a floor mount. In all cases, we do have a look at your clinic's disposition and see where is the best place where we can install the kiosk. So I'll show you what patients will see at the kiosk. So for Ontario, we do have a card swiper. So instead of having to enter it manually their health card number, they can just swipe the card. Right now, I'm just going to manually enter my health card, my pay demo patient's health card number. I'm going to look into the EMR to see if I have an appointment on that day. The patient can update his mobile, landline, email address, city, province, and postal code. In all cases, if all the information is exact, they can only validate that it is accurate. I will confirm, and once I've confirmed, it will change the status of my appointment in the EMR to arrived so that your staff knows that the patient has arrived and they can go and call the patient for their appointment. If I can continue, I can also have direct the patient towards the right place to go. In this case, the clinic has a waiting area A and waiting area B. So, because the patient has an appointment with Dr. Caroline Evans, he has to go to waiting area A. And there you have it, the patient has been checked in. For all three of our solutions, we have various settings, and it always works by provider and by appointment type. So, if in any case you have a doctor that wants to opt out from online booking reminders or medical kiosk, or for very specific appointment type, it's possible to do that configuration. For example, in this case for Dr. Joseph, only his appointments RV10 are made available online to his patients. All of his other availabilities, appointment types are not made available. If I have a look at his appointment reminder settings, I can see that he wants to. I can decide to remind all of his appointment types. So all of his patients that have these appointment types will be sent a reminder. Sorry, and I could say for my RV10, I want to close that off so that none of these appointment types will be sent an appointment reminder. So there you have it. We went through quite quickly the three solutions that we developed for our clinics. And when we developed these solutions, we had some very specific design considerations in mind. First of all, it was important for us that our solution be completely configurable. You keep control on your schedule and your processes. Because that was one of the feedback we had from our clinics. So first of all, we read the templates you use. There's no double data entry. In MedAccess, there are templates. We are able to read them, and you can select which appointment type you want to make available for which provider. There is no double data entry, meaning that appointments will appear in your schedule in real time. Data exchange is done in real time, as I mentioned, as if you had an additional receptionist working with the EMR. So everything is always in real time. Availabilities are in real time, and as soon as an appointment is booked, it will appear in your schedule. You decide which professionals opts in and for which appointment types. We know that in every single clinics there are different providers and professionals that will want to use our solutions differently. So everything is configurable at a professional level and at an appointment type level. So if you have a doctor that wants to opt out completely, it's possible for him or her to opt out. Or on the contrary, if the doctor only wants to put one appointment type online for bookings and wants to exclude one appointment type from the reminders or the kiosk, it's possible to do so. We have other features that ensure that our solution is completely configurable, such as a blacklist to choose who can make an appointment, customizable messages. You can restrict access to faux patients or to fit patients in Ontario. And we do support advanced access practice. So if you want to open your schedule up within a certain time frame, we are able to do that on at an appointment type level, meaning that different doctors could have different advanced access features. We also wanted our solution to be easy to use. As you know, in a lot of the clinics we work with, there's a lot of elderly patients or vulnerable patients, and we wanted it absolute to be easy to use. So first of all, as I showed you, when patients book an appointment online, they only need to use their health card number. We found in our research that having a login and a password deterred a lot of patients from booking online. Second of all, when I showed you how the kiosk works, we have a swiper to swipe the cards, and all of the fonts, the text is big, large, easy to read, and the buttons are extremely clear so that even your elderly patients are able to use our solution. Another one of our consideration was having a support team there from start to finish. One of the feedback we had from our clinics and our clients is that they wanted this hand holding from an implementation team because sometimes it was hard to find a resource internally to just do the initial configurations. So we have a dedicated implementation team and technical support to help you out 7 days a week from 7 a.m. to 7 p.m. So these are three of our best onboarding specialists: Andrea, Andy, and Nora, who will always be there to help you out. Um, what's really important also is that by having an implementation team, you will also establish a plan together. There's something that we call the triple progression. So a lot of clinics might be a bit intimidated by the idea of implementing an online solution, online booking solution or a reminder or a kiosk. But what we always like to remind them is that we go at your rhythm, meaning that you could do an implementation by solution. So let's start with the reminder and then do the kiosk and then the booking. And even within a solution, for example, for the reminders, I could decide to start only with two of my four physicians and then add the two others in a month or two when everything goes smoothly. Or even more specifically, we could decide to start by appointment type. So for this doctor, I want to start online booking for only this appointment type. So we go at your rhythm to your speed and with the implementation plan that we established together. Now that we went through these design considerations, let's have a look at two real implementation examples. So the two clinic we're going to talk about is the Coteau Medical Clinic, which is in St. John's in Quebec, and we also have the Terrain Medical Clinic, which is in the Ottawa region. So the Coteau Medical Clinic there's 15 family physicians there, four NP, one respiratory therapist, and two social workers. They have more than 15,000 registered patients, and they see about 5,000 appointments per month. For the Terrain Medical Clinic, there's 18 family physicians, 3 NP, one psychologist, and one social worker. And in their case, they also see more than 5,000 appointments per month. So, if we have a look once again at the problems that clinics have told us and what they wanted, patients, clinic staff, and clinic managers, we're gonna have a look at, are we answering these problems that have been brought to us? Are we really making it possible for patients to book online, to be more autonomous, to communicate more easily? For clinic staff, is the work environment healthier and less stressful? Do you have more time to do more rewarding tasks? And for clinic managers, do they do more with the same means, so increase productivity? They able to reduce staff turnover and keep the clinic attractive, and to ensure the clinic's budget is well managed? So these are the things we're going to look for. So first of all, to ensure that any of these problems were fixed, we had to make sure that there's a high adoption rate for our solutions. So, Catherine from Terrain Medical Clinic told us that at least 80% of our patients use it. The majority of my appointments are taken using the Chronometriq platform. So, that's great news for us. Even greater news, we learned in August that since August 2019, um, the clinic puts 100% of all of their availabilities online so that patients can book those. Um, when we initially started out with Catherine, she was not convinced about the solution, and after 3 years now, most of her appointments are booked online, and it really helps out her team. For Karima, she says that about 70 to 75% of patients use the kiosk. The remaining 25% are patients whose cards is expired, so they need to come and see the receptionist so that the receptionist and the MOAs can update their health card expiration date. So in the two cases, we see that the adoption rate is extremely good, and that was extremely important for us to make sure that elderly patients were able to use our solutions. So let's have a look at the level of stress at the clinic. So, according to Catherine, the level of stress of MOAs and receptionists has decreased significantly. So, she speaks specifically about the phones ringing and having a large volume of patients at the front desk. So, we know now that phone queues are much shorter, if not inexistent, because patients are booking online. Instead of patients queuing in front of the front desk to be able to check themselves in, they are able to check themselves at the kiosk without even going and disturbing receptionists and MOAs. So she says that since we have Chronometriq, their reality changed. Receptionists don't even need to think about it. Everything is done automatically. So the staff is happy, the girls are happy, and they feel less stressed. So for us, that's something that we were able to do. For Karima, she says something likewise. The stress level has decreased a lot. For her appointment confirmations and patients registration, everything is done by itself, so they don't need to take care of it anymore. Two things about first of all, for email reminder for the appointment reminders, often we think, oh, if I did do reminders, then just having them automated is already a good benefit. But not only are we able to automate that process, but we're able to better reach the patients because we're able to send them messages by email and by SMS. And if they don't answer, instead of just leaving a message, we'll send them further messages until three to a total of three, so that they can until they respond. A- And not only that, by reducing no-shows, basically we allow patients to be able to have like more to see the doctor more easily. For the patient registration, one of the aspects that is extremely appreciated by clinics is that all the data that we're able to collect and also the accuracy of the data. Often clinics, MOAs have told us that they haven't had necessarily the time to collect email addresses, or even mobile phones because just the time was lacking. But now that patients are doing it by themselves, they can fill that out. And if there's a typo, and often there is, they're able to fix that by just having a look at what's in their patient file in MedAccess or PS Suite through the kiosk. So time saved. According to Catherine, receptionists invest their time better. They can focus on working on more rewarding tasks, answering faxes, and doing other follow-ups, since appointment management has been set up automatically. So that's was something that was extremely important for us. We do truly believe that we can save time to clinics and their staff and their managers, and this is the proof that we have been able to save time at the Terrain Medical Clinic. For the Koto Medical Clinic, we can see that the team is focusing on more complex tasks because a lot of the work is done automatically. So the kiosk, she says that even trying to imagine a moment without it is they realize how much it has helped them. For patient service, according to Catherine, she does say that patients do not need to wait on the phone any longer because they're able to book online. And those that can't book online, when they call in the clinic, the the phone is answered more quickly because those the phone queues are freed because patients are now booking online. She also notices that now the patients are able to book online fast, easy to use, and they can do it 24/7. For Karima, she also answers by an emphatic yes. The service, according to her, has improved. So she once again says that she can't live without our solutions. We also surveyed patients to know if they were satisfied by our solution. And according to Catherine, she says that her patients are very happy with the program. It's easy, it's free, it's fast for the patients, and they have access to a doctor 7 days per week. Again, she says that statistics of 80% of her patients using our booking portal and our kiosk. So the majority of her appointments are taken with Chronometriq. And for Karima, she says that her patients are happy because with the kiosk, the registration is easier. Um, and once again, she talks about the reception having more time to answer faxes and the phone. So if we have a look at what we saw initially, the problems at clinics, are patients able to book their appointments online by themselves? Yes. Are they more autonomous? Yes. Are they able to communicate more easily with the clinic? Yes, through our tools, but also by freeing up and giving back time to receptionists, patients are able to communicate more easily with the clinic. For clinic staff, a healthier, less stressful environment. I think that Karima and Catherine had a very good words to say that staff were less stressed and the work environment was healthier. They also really focused on the idea of having more time to do more rewarding tasks because less time is spent on these redundant tasks that are online booking, reminders, and the kiosk. For clinic managers, do more with the same means. Of course, by being able to uh, by having the same team doing other tasks and automating some processes, for sure it increases productivity. Reduce staff turnover by having a healthier and less stressful work environment. We do believe that staff turnover will be reduced. Keeping the clinic attractive so patients are happy, staff are happy, and of course, at the end of the day, if you're able to reduce costs, then it might also be attractive for other healthcare professionals who might want to join the clinic. And finally, to ensure the clinic's budget is well managed, instead of having to hire additional receptionists, the clinics have been able to keep their team in place and make them focus on more rewarding tasks and more complex tasks, so that these simple and redundant tasks are able to be automated at a lower cost. So in all, as we saw with the two um, real implementation examples, you can see that both cases, the problems have been addressed. So in conclusion, as I mentioned, Chrono Booking, Chrono Remind, and Chrono Kiosk, um, have been designed with clinics and our clients, and have been proven to really answer today's clinics' um, problems. So, yeah. We also want to mention that we do have a surprise for people who have registered to the webinar. So there are no activation fees. It's a value of $450 per clinic. But of course, you have to sign the quote for Chronometriq services before October 15th, 2019. If you have any questions, please feel free to contact telesales.emrs@teles.com. Or if you have any further questions, visit chronometriq.com. You will find information, and you will also be able to book a demo or ask your questions that we'll be able to answer. So once again, I'd like to thank everyone for assisting the demo today. And if you have any questions, please feel free to reach out to us, and we'll be more than glad to answer your questions. Thank you very much.